In the studio, probably for the first time, Dr. Rob Williams from Menz Medical. We're here to talk about Blue September. How long has Blue September been going on, do you know?
I'm not sure exactly, certainly a number of years. I've been aware of it for quite a while now. It must be at least 5 years.
Yeah. Is this the most common form of cancer that claims men's lives in New Zealand?
I think it's the second most common cause of cancers. They estimate about 650 men a year die of it.
Yeah.
And about 3,200 men a year get diagnosed with it.
Okay.
So it's one of these diseases that's age-related. The older you get, the more likely you are to get it.
Yeah.
Generally, you don't see much of it under the age of 45, but from 45 onwards, it gets more and more common. It's treatable in most cases, and it's easier to treat if it's detected earlier.
Yeah.
So early detection is a real important thing with prostate cancer.
Yeah. So it's one of the ones that if you get it early, survivability is actually quite enhanced, is that right?
In most cases, yeah.
Okay, there's a couple of ways of getting the test. Let's get the uncomfortable one out of the way first. It's the finger track, and then you've got another way of taking bloods, is that right?
Yeah, the important thing is symptoms. I mean, if you've got abnormal symptoms like, difficulty peeing or slow stream, getting up at night, anything like that, what we call lower urinary tract symptoms, that would be quite significant. I'd also be sort of fairly cautious about prostate cancer risk if there's an immediate family member that had it, like a brother or father, so those would be some indications for getting checks. The other thing, of course, is, getting checks for men as they get older. The two main checks are the blood test, as you say, which is called a PSA, prostate-specific antigen, and, of course, the old digital rectal examination. The digital rectal is very quick. It's just examining the prostate through the rectum and determining if there's any irregularities, nodules or abnormalities in the surface or the shape of the prostate.
Yeah.
And, of course, the blood test is something that has developed over recent years. There are different forms of the blood test, but the most common is just a standard PSA, which is considered normal if it's under 4, but does go up as you get older. So it wouldn't be unusual for a man of 70 to have a PSA of, say, 6 or something like that,
So that may not be the most accurate way of detecting prostate cancer.
It's very, very helpful, but unfortunately it's not ideal, I think it's more useful if it's normal, because it's unusual to have prostate cancer with a normal PSA. I mean, it does happen, obviously, but if it's raised, it can be raised for a whole variety of different reasons, like infection and, the overall size of the prostate. Prostates can get bigger and yet not be cancerous. So if that was the case, the PSA would be up. But that wouldn't necessarily mean you got prostate cancer.
Right. We're talking with Dr. Rob Williams from Menz Medical. The age, we've talked about that, from 45 up, is that right?
Yeah, you generally don't see much prostate cancer below 45. It's very, very unusual.
Okay.
The older you get, like when you get to 60s and 70s, that's the area that you'd be highest risk and beyond.
And just to reaffirm the fact that if you have a close relative who has suffered or suffering from prostate, it'll be a really good idea to there is a link, some sort of genetic link there, is there?
Oh, there's certainly a family connection, yeah.
Okay,
yeah.
All right.
And the symptoms, and also important to get a routine check if you're at all worried about it,
Yeah, because the family want you around. That's why you got so many cards and socks yesterday for Father's Day, boys. The family want you around. It's a relatively easy test. People are uncomfortable thinking about the rectal test, but it's the best way of going.
I know. Men really get quite upset about that, but it's quite brief and quick, and like I will say at the medical centre, you leave your dignity at the front door and pick it up on the way out.
Yeah.
And the blood test, of course, is easy. We usually get that done in advance. Also, when men come in, we get a urine sample done, just check the state of the urine, make sure there's no blood in it and that sort of thing.
Okay.
So it doesn't take long.
Okay, so more information in regards to a Blue September and or prostate awareness. You can help us out with that.
Blue September, by the way, is a brainchild of the Prostate Cancer Foundation. And if anyone wants information about prostate cancer, they can go onto their website, which is prostate.org.nz. And of course, you can donate to the Prostate Cancer Foundation online there.
Yep. look, it's like winning the lotto. You listening to this broadcast, and you've heard from Dr. Rob, you could win the lottery. Not so much the millions on a Wednesday or Saturday night. You could win the lottery by maintaining your health just by listening to this program. And if you do, we save lives. We could have saved someone's life here right now.
Yep, absolutely.
Isn't it? This is just the power of radio.
Yep.
Absolutely brilliant. So, website again?
The website for prostate is prostate.org.nz, and that's the Prostate Cancer Foundation. And our clinic, which deals mainly in men's health, is Beeley and Colombo. And if you want to make a prostate check, it takes about 15 minutes. So just give us a call on 03981 8181.
That's from walking in the door to walking out the door.
Yeah, but we do request a blood test to be done prior, if possible.
Okay.
Yeah.
Okay. Right. Well, that's interesting too. The question that just popped into my mind. You take people who can come in who would normally go to another doctor?
That's right. We accept anybody because there are some patients that feel a bit uncomfortable about going to their own doctor about prostate issues. Especially like if they have a woman doctor or something. I mean, I don't know what particular reasons, but we're very happy to accommodate.
That's absolutely. I think that's actually a bit of a that's a definite tick in the right box as well. Dr. Rob Williams from Menz Medical in south of the river in Christchurch, but we're all listening to this all over from Kaikoura in the north and Ashburton in the south. Thanks for coming in to Compass FM and having a bit of a chat.
Thank you, Kerry.
No,
that's great.
You're more than welcome, mate. Thanks so much. It is Compass FM. It's